Welcome to the Cancer Support Community Atlanta's virtual nutrition programming. I'm Savannah Duffy, Oncology Dietitian with Northside Hospital Cancer Institute. Today's session focuses on the link between nutrition and colon cancer. It was specifically designed for those impacted by colon cancer or those looking to reduce their risk. We hope you enjoy. All right, I am excited to talk about this topic. Colon cancer, as many of us know, it is one of the top cancers in the United States. I think at this point in time, it is the third most common cancer type. So whether you're a survivor, a caregiver of someone who has had colon cancer, or if you're just looking to reduce your risk of developing colon cancer, I hope you'll be able to get some good nuggets of information from today. So on our order of events today, we are going to review the basics of colon cancer. So just touch on what exactly is it? How does it impact our body? Then we will talk about modifiable risk factors. So this will be what we spend a good chunk of today talking about, is that cancer prevention. And then we'll also talk about strategies for bowel management, as well as longer term nutrition strategies for colon cancer survivors. All right, so to start us off, let's get into the basics of colon cancer. So to start, what exactly is the colon? So this is a part of our GI system. It's a muscular tube about 5 feet long. So it is made up of muscle, and that's how it helps to contract and expand in order to move waste from our body. So that is the number one function of our colon. What we typically, associate with our colon is that it is the storage as well as processing center of waste or our bowels. It also has some other really important functions. It helps absorb and store our fluids as well as electrolytes. It also helps produce something called short chain fatty acids, which are involved in the immune system, and it also have important roles in energy metabolism and regulation in the body. Then the colon also helps to synthesize certain micronutrients, including our B vitamins, which does include biotin, but I did highlight that one separately here, as well as vitamin K. So all in all, a very important part of our body. As I mentioned in the introduction, colorectal cancer is the third most common cancer type in the United States. There are some symptoms associated with colon cancer. Pain is one of them, especially if you feel it in your lower abdominal region, as is blood in the stool. So this is one that people typically associate with colon cancer. We also have some other symptoms that are a little harder to link to colon cancer. Things like bowel changes, unexpected sudden weight loss, fatigue, or perhaps someone might not have symptoms at all. So these are good to know because obviously when you think about unintentional weight loss or even fatigue, we so often write that off as, oh, I haven't been sleeping well, my busy schedule. It can be hard to identify these symptoms as colon cancer, which is why diagnostics is so important and why perhaps you've been to the primary care physician and at age 45, they start to recommend doing your colonoscopies. So for many years, that has been the standard of care. At age 45, we start to get a colonoscopy, typically done every 10 years from there. If something suspicious does pop up, we typically then go in for biopsy and maybe do blood tests to diagnose if it is, in fact, colon cancer or something else. The good news is nowadays we have so many advances in technology that we're actually starting to see some other diagnostic measures or screening measures to look at colon cancer. So things like blood tests or DNA tests are emerging and becoming more and more common. And I'm sorry, I think I said blood tests. I also meant stool tests. Once colon cancer has been identified, there are several different mechanisms for treatment. Surgery and chemotherapy are two of the most common treatments. You also might undergo radiation therapy or targeted therapy. The modality for your treatment plan would be very personalized based on you, discussions with your medical oncologists and surgeons, as well as the specific location and kind of cancer that you have. There are some non modifiable risk factors for colon cancer, just like any other cancer type. The first one is going to be age. The majority of colon cancer diagnoses are in folks who are 50 years or older. However, we are starting to see colon cancer being diagnosed in younger and younger individuals. Ethnicity and race might predispose us to colon cancer. We do see higher rates in Black males as well as Alaskan Natives and individuals who are a part of an ethnic disparity, partially due to maybe having fewer resources or access to medical care in order to detect colorectal cancer earlier. If you have a family history of cancer, that might increase your risk. And then there are also certain chronic conditions that can increase risk as well. Lynch syndrome is one of them. This is something that we determine based on your genetic makeup. So it is a genetic disorder. There's another disorder called Peutz-Jeghers syndrome. There's different ways of pronouncing that. But this is a syndrome that actually increases the amount of benign or non-cancer causing polyps on the colon. Even though it increases the risk of these benign polyps, it is associated with higher rates of a colon cancer diagnosis. Certain GI disorders like irritable bowel disease as well as ulcerative colitis do increase risk. We also see some correlation with type 2 diabetes and insulin resistance with colon cancer. And then lastly, there is an increased risk if you have had a cholecystectomy or your gallbladder removed. Okay, so now we're going to pivot and talk for a second about modifiable risk factors. So we just covered the things that we can't be in control of. But the good news is there are things or measures that we can take in order to lower our risk of developing colon cancer. Now, with colorectal cancer, we do really see an increased link between diet and lifestyle to cancer development, even more so than some of the other cancer types. And this has to do with the fact that because food that we ingest or other substances does get excreted through the colon, so it spends a good amount of time in the colon, giving carcinogens a longer chance to be in contact with the cells in the colon. So that's part of why, we have identified that there is this higher link between some of these risk factors and developing colon cancer. Okay, so number one on this list might be no surprise to some of us, is going to be smoking. In fact, research tells us that smoking a pack of cigarettes a day may increase colon cancer risk up to 61%. This is seen in both men and women. Some of the mechanisms that might be leading to this increase has to do with decreased immune function with tobacco product use, as well as increasing inflammation in the body. Smoking also alters our gut microbiome, which of course can affect, how we get rid of waste in our body. It can also further exacerbate inflammation, as well as some other mechanisms. So, risk increases with the number of cigarettes smoked per day, as well as the length of time in which you are smoking. So, if you smoke half a pack for a year, you are going to have higher risk compared to someone who never smokes at all. And then someone who smokes a pack or multiple packs for the majority of their life, or perhaps years to decades, they're going to have even further risk. So basically, the less exposure to smoking and tobacco, the better. Alcohol can also affect colon cancer risk. So we're estimating that there's about a 7% increased risk of colon cancer per 10 grams of alcohol consumed per day. So similar to smoking, the more alcohol you take in, the higher your risk increases. Again, inflammation is a part of the reason for this. Alcohol is pro-inflammatory, but it can also impact some of our nutrient utilization, namely folate. So, folate is a nutrient that excessive alcohol consumption can lead to a deficiency in. And unfortunately, folate is really important in our body helping to fight off cancer from developing at the cellular level. And then alcohol can also lead to some DNA damage. At this point in time, we're suggesting avoiding alcohol as much as possible to lower cancer risk. But if you're choosing to drink, limit it to 1 drink a day for women or 2 drinks for men. And as you can see in this picture here, this is going to count towards really all alcohol types. So your wine, your beer, as well as your liquor. This is really, the link here is really having to do with the ethanol itself. So in terms of cancer risk, all types of alcohol are pretty much going to be the same. All right, physical inactivity is also linked with higher rates of colon cancer. The World Health Organization actually estimates about 16% of colon cancer cases are attributed to physical inactivity. On the flip side, we have some research that suggests that being more physically active can reduce colon cancer risk by 20 to 25%. Now, actually, just this morning, the American Institute of Cancer Research released their spring newsletter. And in that, they actually included some research from a recent study done in the UK that said that if folks are active twice a day, both in the morning as well as in the afternoon, their risk of developing colon cancer was actually lowered by 11%. So I haven't deep dived into that research, but that's very interesting that they found that not only being more active, but perhaps the time of day and how often you are physically active might reduce colon cancer risk. Part of the reason for this is when we are physically inactive or more sedentary, it's going to take longer for our waste to get excreted. So we're going to have increased bowel transit time, meaning that our waste is going to have more prolonged contact with that organ of the colon. Physical inactivity rather is also associated with certain increased hormone levels, including insulin resistance, which has been linked to chronic disease, prostaglandin levels, as well as certain steroid sex hormones. And of course, when we are more physically inactive, it can lead to higher body weight, which we will talk about the link between obesity and colon cancer, I believe, next. Perfect. Okay, so To help us have some general guidelines as to how physically active we should be, we have two camps or two recommendations. The first one is to aim for a minimum of 150 minutes of moderate activity per week. So it looks like I didn't include that. So it's not per day, it is per week. So our moderate physical activity includes things like walking, pickleball, water aerobics, chair exercises, mat Pilates, and yoga. Now, if you prefer more vigorous physical activity, we recommend a minimum of 75 minutes per week. This is going to include jogging or running, singles tennis, playing basketball, and other exercises that really get your heart rate up. Now, we do encourage this to be physical activity outside of your typical day to day or maybe the demands of your job. So, if your job requires a lot of walking, a lot of steps, we would encourage additional physical activity outside of that. So, maybe instead of focusing on getting more walks in for an individual who walks a lot at work, we might recommend switching it up and doing something like strength training or that yoga and Pilates to work some different muscle groups and to continue expanding our level of physical activity. All right, so as promised, going to touch on obesity. So between 30 to 70% of colon cancers in men are associated with obesity. Now, in women, the information is a little less concrete. We have less specific numbers here, but we're still seeing an association between obesity and colon cancer. In addition, being overweight or obese at diagnosis may be linked with poorer cancer outcomes and an increased risk of cancer recurring or coming back later in life after your primary treatment. This also could explain why we're seeing more young individuals being diagnosed with colon cancer. We all know that the obesity epidemic is growing, and we're seeing more and more young folks who are falling into the overweight or obese category. There are several different proposed mechanisms for why obesity is increasing colon cancer. Again, inflammation, just generalized inflammation in the body, is part of it. And then metabolic syndrome is another condition associated with obesity, which may have some cancer promoting effects. Insulin resistance, again, that's a change in how our hormone insulin, which is involved in blood sugar regulation, um, works, and we do see association with that in colon cancer. We also see altered levels of adipocytokines. So these are a protein that are actually secreted by fat tissue. And these are a protein that actually help your body fight inflammation and lower cancer risk. The problem is, most people have some fat. We need a little bit of fat in our body. When we have too much fat, it can actually alter the production and it maybe even decrease when these little proteins are secreted, so our body isn't able to fight off the inflammation. Obesity is also linked with hormonal changes and an altered gut microbiome, which we do again see links with developing cancer. All right. So we also see links with cancer between red and processed meats. Now, the recommendations here are different, so I'm going to talk about them one by one. So, first up is red meat, which includes things like our beef, our lamb, as well as pork. So, often called the other white meat. In terms of our health, we classify pork as a red meat. The recommendation right now is to limit our red meat intake to no more than 18 ounces per week. This is because we see a correlation with higher red meat intakes in developing colon cancer. With intakes of 18 ounces or less, we are not currently seeing any association. So again, this is correlation, it's not causation here. So we're recommending this out of an abundance of caution based on what the data is indicating at this time. Now, processed meats are a little bit of a different story. We actually do see that processed meats are a carcinogen, meaning they are directly leading to cancer developing in the body. At this point in time, the recommendation is to avoid consuming any processed meat to limit additional risk of colon cancer. Our processed meats are going to include things like our deli meats. So, not just the ham, which is listed on this slide, but really any deli meats. Think what you might put on a sandwich or on a charcuterie board. Bacon and breakfast sausages fall into this category, as do hot dogs and pepperoni. Now, a lot of times folks ask, well, what if I buy organic processed meats or nitrite free? While that might help to mitigate the risk, at this point in time, we don't fully understand why processed meats are causing cancer, which is why, again, we really continue to say avoid as much processed meat as possible in order to just really be cautious here and not exacerbate our risk. Okay, so certain nutrients have been linked with decreased cancer rates. So, calcium has been shown, or we suspect, that it does play a role in reducing colon cancer. This is because studies show that higher intakes of calcium intake are linked with lower rates of colon cancer. So right now, the RDA, the recommended amount of calcium, is about 1,000 milligrams a day for men and about 1,200 for women. I see a typo there. It's not 12,000 for women, it's just 1,200 milligrams for women. Vitamin D may also be linked with colon cancer risk. This is seen in observational studies, so not any randomized controlled trials, and it might be due to the fact that vitamin D helps the body absorb calcium and use it more efficiently. There also could be some other mechanisms as to why this is the case. Now, we don't recommend starting off to take calcium supplements to lower colon cancer risk unless you really are having difficulty getting calcium in the diet. But we do take a stance of wanting to get our nutrients through food first, as this is seen to be the most effective in reducing cancer risk. So, our calcium sources of food are going to include our dairy products. These are typically the choices that are going to give you the most bang for your buck in terms of calcium content. You can, if you can't eat dairy or have an intolerance or some other reason for avoiding it, you can get calcium from other foods like our fortified non-dairy milk. Again, wanting to make sure it's fortified because typically our non-dairy milks don't naturally have calcium in them. You can also get it from fortified orange juice. Dark leafy greens have a little bit, as well as other plant foods like almonds, white beans. And then our soy products will also give you some calcium. So your tofu, tempeh, soy milks, things like that. And then sardines or any fish that has micro bones in them that you would be eating the bones themselves will also give you some calcium. Now, your body does absorb calcium best from these dairy and animal products as opposed to the plant foods. So, if you aren't doing dairy products, this might be a situation where you want to talk to your dietitian or your doctor to see if a calcium supplement is needed. Now, with vitamin D, we primarily get it from sunlight. Of course, it's a bit of a catch-22 because we're here to talk about reducing cancer risk, and that also applies to skin cancer. So, to protect against skin cancer, we wear a lot of SPF or we cover up or stay out of the sun. So, that means we're getting less vitamin D from the sunlight. You can get it from some foods, like your fortified dairy or cereals, again, fish, and then certain liver and mushrooms. Or if you struggle to, get your vitamin D in from these sources, again, we could consider a supplement. I do recommend you get your vitamin D checked every year at your annual physical to see if, what your level is and exactly how we should supplement should you need that. All right, next up is fiber. So, when it comes to prevention, fiber is inversely associated with colon cancer. Basically, meaning the more fiber we eat, we typically see lower rates of colon cancer. There's a couple reasons for this. Number one is those short chain fatty acids I mentioned earlier that are involved in energy metabolism and immunity are produced when our gut microbiome, the bacteria in our gut, is fermenting fiber. So basically, it's a byproduct of fiber being broken down in our body. It can also help to dilute carcinogens. So when we have more fiber, more bulk to carry our stool out of our body, it can kind of dilute the proportion of carcinogens versus non-carcinogens in the colon. High fiber foods also help with weight management. They tend to keep us full and satiated without adding a lot of additional calories. And high fiber foods also contain cancer fighting nutrients. So, your vitamins, your minerals, your antioxidants, all those good little nutrient gems that help your body stay healthy and fight disease. The amount we recommend for men and women is a minimum of 25 up to 38 grams of fiber a day. So women have a slightly lower range of that 25 to 30 grams of fiber, whereas men we recommend really reaching at least that 30 grams per day. So this is a good thing to track. Maybe if you're not sure what your fiber intake is, you can consider logging your food for maybe 3 days, maybe a week to kind of see what your baseline is and work from there to increase your fiber intake. Now, the sources of fiber in the diet are really going to come from your plant foods. Fiber is a type of carbohydrate. So you're going to get it from your fruits, your vegetables, your whole grains, as well as legumes like lentils and beans, and then your nuts and seeds as well. So, the American Institute of Cancer Research really recommends about 70% of our plate is these whole, minimally processed plant foods in order to help us reach those fairly high fiber numbers. All right, so the next one is coffee. So many of us, myself included, rely on coffee to keep us going in the morning. And the good news is that several observational studies do link coffee with not only a reduced risk of colorectal cancer, but also reduced recurrence and reduced disease progression. Now, again, these are observational studies. So we're looking at folks and their cancer journey, their cancer treatment, and we're just observing, okay, how much coffee did they drink? What are the outcomes? So no intervention here, which is why this isn't definitive. This is why we don't recommend that everyone needs to drink coffee in order to lower their risk. The reason that we're proposing coffee might be helping fight against cancer has to do with some cancer fighting compounds called caffeic acid and ferulic acid, which are involved with with DNA methylation and gene silencing, meaning when there's damaged or cancerous DNA, these compounds might be able to help kind of eliminate that DNA from replicating. We do remember or recommend limiting your caffeine intake to no more than 400 milligrams a day, and then being cautious about what you're putting into your coffee, as we can easily add, sugars, fats, calories to our coffee if we're not careful. And then, of course, if you are going to consume coffee, make sure you're staying hydrated and that it's not interfering with your daily total fluid intake. All right. So next up, we are going to talk about some considerations for colon cancer survivors. Okay. So oftentimes, as we mentioned earlier, treatment for colon cancer does include a surgical intervention. In the days and the weeks following a colon surgery, your body has been through a lot. So, we actually recommend a low fiber diet for a minimum of 2 weeks. This is to help your bowels, your colon heal and recover from surgery. So, long term, we want to incorporate fiber, but after a colon surgery, we are going to have some limitations. Instead of getting those high fiber foods in, we recommend focusing on protein, which helps keep your immune system strong and also helps facilitate healing after the surgery. Other things, in order to make sure we're not upsetting our bowels after surgery, we recommend avoiding hot beverages, as this can actually stimulate the bowels and keep things moving through faster. And you might need a certain type of fiber called psyllium fiber, which is typically you can purchase in powder form, that actually helps to thicken our stools and slow transit in case your bowels are emptying too rapidly after surgery. This is something that can be mixed in with things like yogurts, pudding, applesauce, and consumed to thicken the stools. And then we do recommend staying well hydrated. Over the next couple of slides, you'll see a theme here, and I'll talk a little bit more specifically about hydration, but you'll want to make sure you're not falling back on your fluid needs, considering one of the main functions of our colon is to help store and process our fluids and electrolytes. Once you're kind of exiting that recovery period, we do recommend reintroducing fiber very slowly. So typically, we recommend introducing it in 5 gram a day increments. So if your eventual goal is to get back to that 25 grams, perhaps you start with 10 grams and you stay there for a week or two, let your body adjust, and then the next week, when you're ready, we might bump it up to 15 grams. Again, let your body adapt before we continue increasing that fiber intake. This is something that is really helpful to work through with a dietitian if you need help creating a meal plan or knowing what foods to have at each stage of the recovery period. Okay. You also, as a survivor, might have to think about certain vitamins and minerals that you maybe didn't really need to think about prior to your diagnosis. And again, this is because a lot of nutrients are absorbed and utilized by the colon. So again, there are links between calcium and the colon. It is absorbed and used by the colon. So you do want to make sure that you are consuming a calcium-rich diet long term. Again, similar with calcium is vitamin D, the two go hand in hand. You will want to monitor your levels long term, at least annually, but sometimes your care plan might include more regular vitamin D checks because we really do see our vitamin D status can change pretty quickly. You also might need to monitor your B12 levels, especially if your surgery included an ileocecal resection. So this is a nutrient that is absorbed and used by the ileum. So if you're missing the ileum or part of, you might need to either take B12 supplements or even do B12 injections to make sure that your levels are staying where we want them to go. Recommendations also suggest if you have multiple dietary restrictions or if multiple deficiencies are appearing in your lab work, so go ahead and take a multivitamin just for a little extra support after you've had colon surgery. Okay, so as I mentioned earlier, hydration is so important for anyone, regardless of a cancer diagnosis, but especially with colon cancer. And again, this is because our colon absorbs water and electrolytes. So after surgery, you'll want to work closely with your care team to make sure we're monitoring electrolyte levels. This can usually be done through lab work, and depending on what your levels look like, they might suggest either things for you to do at home or they might go ahead and give you IV fluids to keep your electrolytes balanced. You'll also just want to monitor your total hydration status. How much water are you getting per day? You can also count certain juices as well as milks towards your daily hydration and maybe some decaf teas. After colon cancer or after colon surgery, you probably won't want to count anything caffeinated, certainly not any sodas towards your daily hydration. For most individuals, we recommend a minimum of 8 cups of hydrating fluids daily, but truthfully, that's on the low end for most people. It depends on a variety of factors, including your height, your weight, any additional health history, as well as the status of your bowel movements. When it comes to our BMs, our bowel movements, really more hydration is best for both constipation and diarrhea. If you are experiencing constipation, staying well hydrated can help promote bowel movements and keep things moving and grooving, essentially. Now, a lot of people feel that, okay, if I'm having diarrhea, I don't want things moving and grooving. So I'm actually going to restrict how much water I'm drinking. Well, really, this isn't the best practice because anytime you have a loose bowel movement or an episode of diarrhea, you are losing fluids and electrolytes in that process. So, on top of that 8 cups a day, which equals 64 ounces, we really recommend an additional 8 ounces or 1 cup of hydrated fluids per loose bowel movement in order to make sure we're staying hydrated. Now, another way to check your hydration status is to take a look after you urinate and see the color. We really want it to be a light yellow or a clear color. However, as I mentioned on the last slide, a lot of times we might need B12 supplements or shots. And that B12 is a water-soluble vitamin, meaning when your body gets more than it needs, it excretes it in urine, and it can actually make your urine look very yellow. So keep that in mind if you're like, goodness me, I'm drinking so much water all day long, but when I look in the toilet, it's still yellow. Check and see, are you taking a B12? That could be what's going on. It could be just simply changing the color of your urine, where you might actually be plenty hydrated. So that doesn't happen super often. Typically I don't see people overhydrating. It is possible, but just keep that in mind. Okay, in order to help with electrolyte balance, you can try some electrolyte beverages. There are some that are store-bought. Pedialyte and BioLite are two of my favorite brands. I put a picture of BioLite on the screen here. You can actually buy this in the bottle form or in the powder form that you add to your own beverage. I really like this brand. It was actually formulated by an anesthesiologist whose wife had breast cancer. I've actually met the CEO and founder of the company and his family. It's a family-run business. And a couple of months ago, after the hurricane, a lot of hospitals, including Northside, went through an IV fluids shortage because after the hurricane, there was difficulty getting the IVs to hospitals. So we ordered a ton of BioLite to help keep our patients hydrated in the hospital and keep their electrolytes balanced. So it's a really great product, really beneficial for anyone who's struggling to get hydration in or is having excessive fluid losses through maybe excessive sweating or that diarrhea. Now, if you don't want to purchase these products, sometimes they can add up in cost. You can make your own electrolyte recipes. I've included a couple here, so if you haven't had a chance to write them down, again, feel free to come back to the recording of this seminar. But you can use different bases, whether a water base, a broth base, or even a juice base. And you'll typically end up adding a salt or a sugar to these beverages. And the reason that we're including sugar here, because a lot of people might go, whoa, you want me to put added sugar in my drink? I thought we were supposed to avoid that. Typically, you are. When it comes to sodas, sweet tea, absolutely. But when it comes to electrolytes, your body at an intracellular level does need some sugar in order to absorb and utilize those electrolytes efficiently. So when you're having these electrolyte drinks, that sugar is actually going to be helpful. All right. So to kind of wrap up for our cancer survivors, this is what it looks like long term is going to be different from person to person. I work with some individuals who are 20 years out of colon surgery, and they're like, there's still some foods that my colon hasn't gotten used to. Sometimes it changes. There might be some foods short term you can't tolerate, but long term comes back around, and vice versa. Sometimes individuals do develop intolerances longer term of something that they used to be able, maybe a year after treatment for colon cancer, they were tolerating just fine, but all of a sudden their colon, their GI tract isn't really working well with that food. So this is going to be very individualized. A couple major tips, if you can tolerate things, what, we really want to see is that we are getting adequate amounts of protein, ideally from both animal and plant sources, while minimizing our red and our processed meat intake. We also want to make sure we're getting an abundance of plant foods. So as I talked about earlier, for that fiber, as well as those cancer-fighting phytonutrients. We also want to ensure we're getting enough calcium, either through dairy or dairy alternatives to help lower our risk of recurrence. Make sure we're getting adequate hydration. This will be a lifelong concern or consideration. Again, not just for colon cancer survivors, but really for everyone. Our survivors will want to monitor their lab work, check for electrolyte and micronutrient imbalances, while also engaging in regular physical activity to help with weight management, reducing inflammation, and reducing recurrence. And then if you do have a history of smoking, we do encourage, very strongly smoking cessation. Luckily there are a lot of community resources for that. Northside does offer smoking cessation classes. So if this is something that you're thinking about, that it might be time for you to nix that habit, feel free to reach out for support in that process.
Thank you for joining Cancer Support Community Atlanta for this program. If you're interested in other live or recorded programs, please visit the online program tab of our website, cscatlanta.org, or follow us on Facebook. We'll be sharing additional information on upcoming programs.